Hip-hop artists are being mobilized to join the fight for healthcare reform. Featured on a Service Employees International Union panel discussion was Maureen Yancey, the mother of Dilla, a hip-hop artist who died of lupus in 2006 and who was uninsured when he died. Also on the panel, Malik Phife Dawg Taylor of A Tribe Called Quest and hip-hop Caucus CEO Reverend Lennox Yearwood Jr.
In the 20th century, they had to deal with issues of equality. Literally about two different water fountains, different bathrooms, different pools, hotel rooms, who can sit where on the bus, equality. That was the fight of the generation before us. And they had to fight against Jim Crow. And honestly, they beat Jim Crow. But the thing here is that Jim Crow, like our parents had you, Jim Crow had babies too. And so while they beat Jim Crow, we're now fighting the descendants of Jim Crow, who I like to refer to as James Crow Jr. Esquire. Or in this case, Jennifer Crow, MD. And what that means is that the Crows are much more sophisticated. And so as we're dealing with healthcare, the reality is that our people are literally dying in the streets of the richest country in the world. And we must now be at a point here to take this seriously. My mother went to the hospital about a week and a half ago with walking pneumonia. And thank God she had health insurance. But if she didn't have health insurance, she would not be here today. And there's so many people in our communities. And the great thing about hip-hop is that we are the generation, we are the first generation, where the sons and daughters of former slaves work side by side with the sons and daughters of former slave owners. We're black, we're white, we're brown, we're yellow, we're red, male, female, straight, gay, theist, atheist. We're hip-hop. And we now fight a challenge here because we must now deal with the reality that people are dealing with existence. We must fight for the climate, we must fight for better schools, but we must fight for the fact that there are poor people right now who are sitting here, who have fallen down and are deciding if they can go to the hospital. We are sitting here with grandmothers like my dukes who are sitting here who will not go because they do not have, they don't have health care. We are sitting here today as people are dying as we talk. And so in this generation of hope and change, and a generation where we've seen so many changes, it's time for us to fight this battle. And so healthcare must be our battle. Healthcare must be our lunch counter moment for the 21st century. We must fight this battle, and we can fight this battle.
Normally, I find it kind of odd being a part of things like this. If it wasn't for what I've been through the last 4 or 5 years, and prior to that, Dilla's situation, God bless his soul, that's basically what made me come to my senses and say I have to do something to help him out. And basically my story in a nutshell, back in, I guess it was 98, 99, right after the group broke up, I found out that my kidneys were shot. Because like you said a few minutes ago, I became diabetic in 1990. Didn't really take care of myself the way I should have. So when I found out my kidneys were bad, it was pretty much inevitable that I was going to have to go on dialysis. So basically when I found out my kidneys were bad, they said, when I got checked, they said that within a month or two that I'd have to start dialysis. Fortunately enough, I don't even know if it was fortunate, but fortunately, it wasn't until 2004 that I had to go on dialysis. When I got on dialysis, it was rough. It was rough. I was on what you call peritoneal dialysis, where you do it at home by yourself. Because it fit my lifestyle, I was still able to travel, even though I had traveled with loads of medicine. I was still able to go on tour when Tribe decided to do shows again and things of that nature. In 2006, when Dilla passed, things started to get worse for me. And between the months of, I guess, October, and then Memorial Day of 2007. Those were like my worst months. I thought I wasn't going to make it because it was just horrible. So one thing led to another. I was back and forth from the hospital, couldn't hold down any food, things of that nature, lost a lot of weight. Then they finally put me on hemodialysis, where you go to the clinic for 3 times a week for about 4 hours. Some people are different due to their bodies or what have you. And then I started to lose weight because my heart started acting up and it was only working at like 20%. So then, basically, I started to feel better due to the hemodialysis. So when I lost a lot of weight, a lot of people thought I was really, really bad off. But I was actually feeling much better than what I looked. You know what I mean? And it helped my heart get back to 75, 80%. You know what I'm saying? And then 2008 came around, we were on the Rock the Bells tour, things started looking up, and then come to find out that my donor was right up under my nose the whole time. My wife ended up being my donor. Got the kidney transplant September 2008, and I'm here today speaking to yours. So God is good, and whatever I can do to help, I'm here.
I asked Taylor and Ms. Yancey about the role private health insurance companies played in their experiences.
I had Medicaid, or Medicare, one of them, I don't know the difference, but I had it, but I was better off getting under my wife's plan, because she worked for Kaiser Permanente, so I just happened to be in the right place at the right time. So I was lucky, but I never had a problem with my insurance or anything like that, so I was blessed. But there's so many people that are not as fortunate as myself.
Yes, insurance companies have gotten in the way of J. Dilla's health care. When he was ill for so long and went into Cobra because he hadn't worked for so many months because of his illness, I think it was 18 months or so that you are in Cobra before they drop you, and we were faced with that during his most critical hospital stay. And so we were faced with no coverage. So what you do then is, of course, you decide your life away, and it's just like I'm signing for whatever, it doesn't matter, whatever I have to do to get his care. So, there was no, although there are supposed plans for, some type of social worker to come and talk to you about what plan to make for the hospital to give you this care, no one ever came to Dilla's room. And I can say that because I was there 24 hours a day with him at the hospital stay, and never left his side. So I know for a fact that there was nothing done, and that's why I faced 6 figures every time we had a hospital stay. It was at least over $200,000 for every hospital stay we had, and we had, my God, at least 3, 4 hospital stays per year.
So there's almost $1 million worth of debt.
Per year. Yes, per year. He was sick for 4 years, and maybe one of those years we didn't have to stay in the hospital more than 2-3 weeks, but on the last two years, I just lived at Sinai. People thought I worked there. So, I was greeted every day. People thought I worked, and some of the nurses asked me what floor was I on now, because I never left, because I wasn't leaving until we left. So, yes, it's very real. The costs, they don't go away. They just sit there with a different account number until the next hospital stay. So when Dilla passed, I started receiving bills, and I knew the first bill I received was over $240,000. And then there was another one, and there was another one. And before it was over, I had 5 or 6 different bills that were well over $250,000 each.
How did you cope?
Well, you just pray and just keep stepping. There was nothing in this world that I wouldn't have done. I would work to the last day and last hour that I lived, doing whatever I was asked to take care of that, because it was important to try to save that life. And that's what's so important now, that we save lives.
Absolutely. And so what we need to do now is to make sure that that's not the story that we keep telling.
Yes.
Right? We are going to make this change happen this year so that we can be empowered and handle our business.